Today we're doing an advanced lesson for the arm triangle. Some new concepts I learned over the weekend. So please lie on your backs. Feel your connection to the floor. And feel the parts of you that are touching, and particularly bring your attention to the spaces. The space behind the back of your neck, the right and left side. The space under your shoulders before your shoulder blades come in contact. Can you identify precisely where your upper back starts to connect with the floor, where your upper arm connects with the floor? Are there any spaces under your elbows or wrists? And are they the same from the left side to the right side? And sense any space under your lower back as it curves away from the floor. Space under your knees, your ankles. And sense your breathing. Notice if there's any movement in your ribs, your chest. Is there any movement into the ribs on the side of you, all the way up under your armpit? Is there any movements into your back as your lungs expand and relax, letting the air flow out? And then I want you to imagine that you have a bowl of water filled to the brim, and you're going to place that bowl just below your belly button, between your belly button and your pubic bone. And you're going to set that bowl of water there and see if you can sense if the bowl of water tilts a little to the left or to the right. Does it tilt a little up or downward? Maybe it goes a little down and to the left, or down and to the right. Just notice that. See if you can sense any of your natural asymmetries. And then set the imaginary bowl aside, and we'll come back to that. And then slowly bend your knees up one at a time. And with both feet, gently press your feet into the floor and relax. And see if you can feel the pressure through your feet softly translating into a rolling movement in your pelvis. Can you let your pelvis roll back, your lower back flatten towards the floor, and then releasing the pressure from your feet, feel your pelvis come back to neutral and the curve return to your lower back. Just very softly, not a lot of effort, not a big movement at all. Pressing, rolling the pelvis and releasing. If you've been instructed in the past in something called a pelvic tilt, this movement appears very similar, with one distinct difference being that the movement completely comes from pressing through your feet and allowing your abdomen to stay soft and relaxed. So we're not trying to contract the abdominal muscles at this point. And then a couple times, just 2 or 3 times, do the same pressing through your feet, but intentionally don't let your pelvis roll. So you're almost going to create a very subtle resistance to that movement. So you press and you keep your lower abdomen, your low back very stable. And then you relax, Do that 2 or 3 times. And then return to the first movement, pressing through your feet, slowly letting your low back soften and flatten into the floor as your pelvis rolls. And releasing it, letting the curve come back. And beginning to feel how far up your spine do you feel this movement. Can you feel it through between the shoulder blades up into the neck? Is there a subtle lifting and lowering of your chin? And for some of you there may not be, and that's fine too. And then just pause for a moment with your knees bent. Feeling your breath. Feeling the expansion of your chest, your ribs lifting and lowering. And then slowly and gently begin taking your right leg out to the side and back to the middle. Just rolling it a little bit, not a big movement, not a stretch, not fast, but just feeling your hip joint of your leg rolling and the joint of the pelvis as you move your knee a little bit out, dropping your leg a little bit towards the floor and back to the center. And if it's easy and comfortable, you can grow that movement, dropping the knee further towards the floor, or you can keep the movement very small, very safe, non-threatening to the nervous system. And see if you can feel as you take your leg out to the side that the weight shifts below your pelvis. Does it shift a little over to the right? Does the left side of your pelvis lift up a little bit? Just feel that. And then bring it upright and pause in the middle for a moment. And then return again to the same movement, taking your right knee out to the side. And again, if it's easy, take it farther. If it's not easy, keep it very small. And see as your pelvis, as you feel the movement of your pelvis and the pressure shift behind the right side of your pelvis. Notice does your left leg want to drop a little towards the right? And try to intentionally keep it upright, facing the ceiling. And then again, pause. And bring your feet a little further apart this time. Normally we keep them about hip width apart, but a little further apart so that you can begin dropping your right knee towards the left. So you want enough room so that if that movement is easy for you, you're not bumping it into your left knee. So go ahead and begin dropping your right knee towards the left. Feeling how you do that. What does it feel like in the hip joint? Feel the safety and the stability of your pelvis and your spine. You might feel the weight roll a little bit to the left side of your pelvis. And it's okay to search around a little bit for the perfect place for your right foot to be as this movement becomes easier and lighter. You might have more freedom in the hip joint, be able to move it more, so you can move your foot out even farther. And as you take your right knee down to the left, see if you can get a sense of it, the thigh, from the hip to the knee lengthening. So your knee is dropping to the left, but it's also lengthening away from your trunk. As if somebody were down by your feet, just gently pulling your knee towards them. You feel your foot shifting to the inside edge. How you use your right foot and your left foot. And see if you're aware of what's happening deep inside your pelvic floor, your trunk. And notice what else is responding. How is your pelvis shifting? What do you feel happening through your spine, your ribs and trunk? And then pause in the middle. If it's comfortable, bring your legs down long for a moment. And just feel the influence of this very simple movement on your body, on your trunk. Does the right side feel more different now than the left side? Your legs, your feet, the weight of your pelvis. And then again, please bend your knees up. Comfortable distance apart for your feet. And bringing your attention to your left leg, begin dropping it gently out to the left and bringing it back up to the middle several times. Feeling that movement, making it lighter and easier, smoother, softer. How gentle can you be with yourself? Feel how the weight shifts across the sole of your left foot as you go to the outside of your foot, and you bring the knee back upward and your foot is flat on the floor again. Feel the weight shifting behind your pelvis as your knee drops to the left. Can you feel the weight shifting to the left side of your pelvis? The right side somehow getting a little lighter. There's a small amount of rotation towards the left happening in your pelvis. See if you can feel this anywhere else in your body. Up your spine, to your sides, your shoulders and head. And then again, pause in the middle, just resting. Letting the brain have a break from attending to yourself, attending to your own sensations, your own feelings, your responses, your curiosity. Our brains are well-trained bodybuilders in attending to the external world. So we want to start slowly as we begin to train them to attend to our inner world of sensation, of where our body is in space, of how well we're listening to the movements, the impressions, the emotions. And then begin dropping your left knee inward to the right. So again, you may want to spread your knees a little farther. As you begin to explore this movement, just start very small, and like I said before, if it's challenging for you to rotate your hip or your pelvis or your low back in this way, keep the movement small throughout the entire lesson. And if it's easy and safe, pleasant, then grow the movement larger and larger. Feeling the pelvis move, the spine, the ribs. And again, see if you can have a sense that your left leg is gently lengthening. So your left knee is lengthening out past your right knee. As it turns or drops inward to the right, can you get that sense of lengthening through your thigh? As if someone's standing below your feet, just gently pulling and inviting it forward while it's dropping to the right. And as you do this simple movement, notice, does your head want to roll? Can you soften your neck and your jaw? Keep your breathing free. And does your head want to roll a little to the right? Maybe it wants to roll a little to the left. Just see if you can let your neck go and let your head follow the movement. Nice. Good. And then bring them to the middle. Lower both your legs down and take a full rest. Just feeling how you're connecting with the floor now. Notice particularly the space of your low back. Is that beginning to change at all? Contact with the floor. Maybe it's softening a little bit. And again, please bend your knees up one at a time. And return to the first movement, just gently pressing both feet into the floor, letting your pelvis roll and your back flatten. And releasing just a couple times, feeling that symmetrical movement going through your pelvis and your spine, between your shoulder blades, up into your neck and your head. And then one or two times resist the movement, so you're still going to press through your feet, but you're going to find a don't push hard, make it very soft, very subtle, imperceptible to somebody watching. With that little bit of pressure, and then deep from your core, that little bit of resistance, not letting your pelvis roll backwards, and then releasing it, just doing that 2 or 3 times. And then coming back to a resting position with your knees bent, feet flat on the floor. And now gently begin taking both knees to the right and back to the middle. Again, for some of you, this will remain a very small movement, just an inch or two to the right and back to the middle. And others of you find this very light and easy. You may even begin to drop your knees all the way to the floor. But that's not the goal. The goal is to feel the quality of the movement. Often I find moving slower, doing less, allows me to become even more sensitive to the subtle sensations inside of myself, the subtle connections from my feet, my pelvis and my spine, my ribs. And as you drop your knees to the right, can you feel that lengthening through your left thigh, your left knee? Can that become a part of this movement? Feeling the weight shift under your pelvis. Feeling it lighten under the left side. And feeling it move all the way through your spine and your trunk. And then pause for a moment. And then gently begin exploring taking the knees to the left. Start with a very small movement. Feel it in your pelvis, in your spine. Feel the weight shifting across your feet. Tilting to the left and coming back to the middle. Notice if there's an invitation for your right leg, your right thigh to lengthen a little bit. Can you feel your right shoulder blades being affected somehow? Does your head want to roll? Try just letting your head roll to the left with your knees. And then again, pause in the middle. Bring your feet and your knees together so they're touching. And just 2, maybe 3 times, gently press your left knee into your right knee without letting them turn, without letting them roll. Just gently press and release. Very subtle. This is not a big contraction, isometric exercise. It's just how subtle can you be with yourself and still feel that very subtle response of resistance. And when you've done it a time or 2 or 3 with the left knee, then try it with the right knee, just gently pressing into the left knee resisting, and really sensing where does that resistance come from. And then bring your feet hip width apart again. And just a couple of times, take your knees to the left and to the right. Just feeling the pelvis rocking from side to side. Any effect in the shoulders, the head rolling, the thigh lengthening. And then pause in the middle and take a full rest, please. And continue to notice how you're fitting against the ground. How does the ground come up to support you? And how do you just settle into this nice, ever-present, supportive floor? Now let's take that imaginary bowl of water for a moment and place it on your lower abdomen again, between your pubic bone and your belly button, filled with water, and notice if anything's changed. Is it tilting more or less one way or the other now? To the right or to the left, a little up or a little down. And then go ahead and set the bowl aside again for a moment and bend your knees up one at a time, please. Comfortable distance apart. Now raise your arms both up towards the ceiling with your elbows relatively straight but not locked, not a lot of effort, and bring the palms of your hands together so that your arms are forming a triangle over your chest. And see if you can gently lift both arms up towards the ceiling, lifting your shoulders away from the floor and lowering them back down to the floor. And just do this several times, feeling what happens in your chest, your sternum, your ribs. What happens in your neck and head? Notice at what point do you want to breathe in and breathe out. And when you've done that several times, just let your arms rest for a moment. So as we work with the arms in this way, even if I haven't recommended a rest, if you're feeling fatigue or strain in your shoulders or your neck, rest when you need to. Listen to your body, take care of yourself. If for some reason you have a condition that's making this position too painful for your shoulder, your neck, or your upper back, you can just place your hands together with your elbows bent somewhere over your chest and just mimic the motion as much as possible. It doesn't have to be perfect. Close enough will still provide valuable information to your nervous system about your movement. So again, palms together over your chest, elbows relatively straight if you're able to. And a few more times, lifting them away and placing them back down. See if you can feel the back of your shoulders peeling away from the floor as they lighten their contact. And see if you can do this movement while simultaneously pressing your lower back into the floor. So if you remember that first movement that we did, where you press through your feet and your pelvis rolls, can you include that, pressing your lower back down and reaching your arms up, and then releasing everything and coming back to neutral? Notice how you're breathing, keeping the movement light and easy. And then a few times again, doing the movement, pressing through your feet, but intentionally not letting your low back flatten towards the ground. What does that feel like? Now that you have a sense of doing it one way, including your lower spine, now intentionally resist including your lower back. And then rest. Rest your arms down. Rest your legs down. Take a full rest. Listen. Have you been taking care of your arms and your shoulders and your neck? And then again, please bend your knees up one at a time. Bring your arms in a triangle over your chest. And begin to lower your arms a little towards the right. Just gently taking them to the right and back to the middle, keeping the angle of your elbows the same. So you'll notice that the right shoulder and shoulder blade presses into the floor and gets closer, while the left shoulder lifts away from the floor. The left arm lengthens a little bit. Notice what your head wants to do. Notice, is there any invitation down your spine into your pelvis and legs to participate in any way? Feel that possibility. And then rest your arms for a moment, please. And bring them up again. And this time, gently press your left hand into your right hand, but don't let your right arm and hand move. Just gently press, resist, and release. And how soft can you make that pressure and still feel the capacity to resist it? How gentle can you discover yourself and your own stability? And then a couple times, let both hands go to the right again. Just let everything move to the right and back to the middle. The arms, the shoulders. See if you can begin to feel even more possibility of including your pelvis and your feet. And relax your arms again, please. And just feel the difference between your right arm and left arm. The back of your right shoulder blade and left shoulder blade. Even the back of the neck or the sides of the neck on the right and left sides. And then again, please bring your arms over your chest with your knees bent. And continue with the same movement, taking your arms a little to the right and back to the middle. But this time really encourage your pelvis to go along. So press a little bit through your left foot. So the left side of your pelvis will lift a little bit. Your pelvis will roll to the right. As your shoulder girdle rolls to the right, let your head go. Keep your knees relatively facing the ceiling, so not a lot of rolling in the knees, but that it's all happening from the pelvis through the trunk all the way to the top of the head. Good. And then see if a couple times you can press the left foot, but don't let the pelvis roll while taking your arms to the right. Have that connection through the left foot, but keep the pelvis down and take your arms as easy and comfortably as you can to the right. And just check in with your breathing and your jaw to make sure you're not tightening anywhere unnecessarily. And then let your arms down, let your legs down, take a full rest. Feeling the support of the floor, the spaces under your neck, your shoulders, space under your low back, behind your knees. And then bring your arms up, bend your knees up one at a time, please. And gently begin exploring your way to the left with your arms. Feeling that left shoulder and shoulder blade come closer to the floor. And feeling the right shoulder and shoulder blade lighten and peel away from the floor. And feel what happens in your neck and your head. And just intentionally let your head roll to the left each time your arms go. And see if you can just feel that natural invitation down your spine, into your pelvis. If you've been doing many lessons, you might feel that natural connection all the way down to your right foot. And if you don't, no worries. All in good time. Good. And rest your arms for a moment. Just a mini break so the shoulders don't get too tired. And please bring them up again. Same triangle position. Taking them to the left, letting your head roll to the left. Good. And come back to the middle and pick a point on the ceiling to fixate your eyes on. Keep your eyes there while taking your arms and your head to the left and back to the middle. So your head rolls, but your eyes stay fixed on the ceiling. Your arms move. Your head moves. And notice if your jaw is soft. Are you breathing? Good. And then let everything go to the left a few times, head and eyes. And let yourself feel it all the way down your ribs. Let your pelvis roll a little bit to the left. Let your right foot support you by pressing into the floor. Good. And let your arms down. Let your legs down and rest. Feel your breathing. Feel the movement in your abdomen, your chest, your ribs. And again, bend your knees up one at a time, please. Bring your hands into the triangle position. Begin to take your arms and hands to the left, feeling your whole body participate. Just once or twice. And then next time you're in the middle, do the movement where you're just softly pressing your right hand into your left hand, but you're resisting with your left hand. You're not letting it go. Very gently pressing, resisting. Just 2 or 3 times, and then do it a few more times with both hands going to the left, the body following. And then see if you can do the movement 2 or 3 times, taking the arms to the left, the pelvis to the left, but turning your head very gently to the right. Remembering this is not range of motion or a stretch. This is just feeling that soft quality. Can it be just as easy to softly turn your head, even just a little to the right, as it was to let your head roll to the left? Great. And when you're ready, let your arms down again, please. Good. Bring your knees up, bring your arms up. And just begin taking your hands to the left and to the right, letting your head follow. Feeling first one shoulder peel off the floor, then as you go through the middle, the other shoulder peels. Let your head follow. Feel the ribs moving with the shoulder. Let the pelvis participate. Feel the feet pressing. And even let your knees go left and right with your arms so that everything's rolling a little left together, even the knees, everything's rolling a little right together. Beautiful. And just take a quick moment, rest your arms. Good. And bring the arms back up again, please. Now this time, take your arms left and right and begin to take your head gently in the opposite direction. Good. Good. And notice, where do your knees want to go? Can you let your knees follow your arms while your head goes in the opposite direction? And then pause in the middle. And let your arms and your head roll left and right. And see if you can take your knees in the opposite direction. Breathing, keeping your jaw loose and soft. Good. And stopping in the middle, relaxing your arms down, keeping your knees up. And bring your arms up again over your chest in the triangle. And roll everything left and right. Arms, knees, head, all to the left as far as is easy and comfortable. No need to strain. This isn't a stretch. This is a quality of movement and a quality of being with yourself to discover how you are, how you direct your own movement, how you listen to yourself. Then pausing in the middle. See if you can press your left hand into your right hand. So your right hand's going to provide a little bit of resistance. But let your head and your knees turn a little to the right. So your left hand presses, but it doesn't go, but your head and your knees go to the right. Just a couple times. Again, remembering how light can you make that pressure. There's a lot going on there. A lot going on. And then pause in the middle and press the right hand into the left hand gently and let the head and knees turn to the left. And breathe. Remember, I said this was advanced arm triangle. Good. Good enough. Let your arms down, let your legs down. And one last time, please bend your knees up. And with just your knees up, gently take them left and right. And just feel what this movement is like. Movement is now across your pelvis, your trunk, your spine. See if your head wants to follow, your chest and shoulders. Beautiful. And then pause in the middle, bring your arms up into a triangle, and just reach them up towards the ceiling, feeling the shoulders peel off the floor and placing them back down. Just 2 or 3 times. Lifting and lowering. And then a couple times letting your arms go left and right, just feeling that full movement through your arms, your head, your trunk. Nice, nice, very good. And when you've done that 2 or 3 times, back and forth, keeping your knees bent up, let your arms down to your side, and very slowly explore your way back into pressing through both feet, connecting into the pelvis, feeling the pelvis roll, the lower back come into contact with the floor, and releasing that, letting the curve come back into the lower back. And just feeling how far up your spine, between your shoulder blades, your neck and your head, can you feel that movement? And then one last time, resisting that movement, maybe just once or twice, pressing and not letting your pelvis roll, finding that very subtle but very deep internal stability. And then finishing with 1 or 2 full movements, letting everything be soft. So discovering that capacity to have both mobility and stability, but intelligent stability rather than the over-guarding, armoring stability that we create for ourselves unconsciously. And when you've done that a few times, just let your legs down. Feel yourself lying now. One last time, place the imaginary bowl of water on your lower abdomen. And just see if it's changed, how it rests there, how you support it. Imagine yourself placing it off to the side again, feeling your breathing through your abdomen, your ribs, your chest, into your sides and into your back. And then staying with your breath, take your time to roll to your side, come up to sitting, eventually coming up to standing, and just take plenty of time to feel yourself standing and eventually walking. Don't rush into anything. See how long you can linger in any new awarenesses that are coming to you from this lesson. Enjoy your week. Good day.